talk about a case study in healthcare tied to the mobile experience. I'm going to skip this part. Most of you probably already heard it. I'm tired of saying it. How's that sound? Let's jump right into it. The agenda for today, give you a little context around what we're seeing in terms of healthcare and its relationships with its patients, its customers, specifically with its customer service, what we believe a process could look like, and some of the metrics and some of the value in the ROI side of it. You know, from our perspective, healthcare as an industry is ripe for disruption. As we talked about throughout this day, right? All the things we've talked about is finding things that are very common, things that your peers, maybe your competitors are doing, and finding a way to change it and making it more succinct, easier to use, efficient, and drive stickiness with your patients. And we believe healthcare is one of those industries that's ripe for change. So if we talk about disrupting markets and upsetting the balance and doing something special with technology, we love the idea of doing this in healthcare, and I'll tell you why. If you have to book travel, a car, a hotel, an airline, you're going to do it online. You've been doing that for years. If you want to book a pizza, you don't even have to pick up the phone and call somebody. You can just, without interacting, you can do that. 80% of the transactions that occur in travel, and even more so increasingly in the pizza sales business, right, is happening autonomously without interaction with people. However, in healthcare, 88% of the time you need to schedule an appointment with a doctor, you do it via the phone, which is mind-blowing, right? It's akin to the Sioux Falls coupon book that had 371 pages in it, if you were at the last presentation. So this process that happens in healthcare around phone calls and callbacks and voicemails is just one piece of the puzzle that we believe leads to an industry that's ripe for change. And we don't believe that this customer service, some people would say it hasn't changed in decades upon decades, and I would say it's certainly in the last 20 years it hasn't changed anything that's truly effectiveness. And what we're talking about doing with healthcare is really trying to create a stickiness and a customer service aspect of it. So what we're talking about is an expectation and a satisfaction level that patients have, right? Customers have. And what we're finding is that the majority of patients have a problem with waiting, right? This is just waiting to get looked at when you have an appointment. They believe 63% of them, based on this study, that's the most stressful thing they have to deal with. 85% say they have to wait in for 10 to 30 minutes past their scheduled appointment to actually see their doctor. Do you know what healthcare providers do to help with that problem and why this happens? They double book, they triple book, they quadruple book. So what happens is it becomes a vicious cycle. So I set an appointment to go visit the doctor, and I sit in the waiting room, and there is a percentage of people that never show up because they know they're waiting, right? So now the healthcare provider says, well, there's a possibility Brett's not going to show up for his appointment. I'm going to double book. I'm going to schedule somebody else to be at that appointment when he's supposed to be there. And guess what? If I show up and the other person shows up, we're waiting. Which means what? The next time I book an appointment, if it's not urgent, critical, important, I may not go, right? Because I'm tired of waiting. I had to wait last time. But it's a vicious cycle that the healthcare, they get involved with and they can't get out of because they have to double book. They have to have those time slots filled. Yet from a customer service perspective, I don't want to wait. I don't want to stand around. And so I'm going to not show up next time. Well, then they have the slot open, so they have to double. So you can imagine how frustrating this can be. So in addition to the I'd call the underperformance, there's an expectation problem as well. There is a high dissatisfaction with the service because of the massive time waste, and they have low expectations. They've redundant paperwork, they're going to be waiting, and it's an inefficient, archaic way of doing things. So we've got an underperformance problem and we've got an expectations problem that are both causing an issue relative from a patient's perspective when viewing a healthcare provider. So based on some of the discussions we've had with our customers, healthcare providers, we've come up with an idea, an ideation. And again, this applies to healthcare, but take this ideation and apply it to the way your business works as well, beyond healthcare, banking, finance, insurance, manufacturing, whatever it may be. Think of some of these ideas and apply it to the way you do business as well. We've come up with kind of a woven blanket of experience for the customer as it relates its relationship with the healthcare provider from start to finish, from scheduling to post-care, and have an integration to the EMR, the electronic medical record system, right? The software that runs the business for the hospital. So what we're talking about is really the woven blanket being many, many modules, right? I'm going to have a hard time probably articulating all the things we've identified as pain points, but I'm going to hit on some of the bigger pieces in this woven blanket and talk about them in more detail and explain to you what a process could look like in terms of full disruption of the marketplace, right? Now, for some providers, there may be pieces of this they're doing already, and there may be some of the things that maybe aren't as critical, but there are certainly pieces of the woven blanket that fit with just about everybody. So how's this process work? Again, full disruption of the market. Some of this stuff we've been doing for a couple years now with some of our relationships we have with providers, but it starts with the patient portal. It moves to pre-appointment, and it has a post-appointment piece to it as well. So what's the patient portal, right? It's a mobile app on your phone, right? It's not a mobile website, mobile app on your phone. We talked about usage and stickiness in the technology trends earlier, whereby you can do research and gather information at a very basic level, right? I can understand what doctors they have there, what their specialties are, where they're located, what's the locations of the facilities. I can get mapping to that facility based on where I'm located now. I can see wait times, again, driving back to that problem of, I think it was 63% of the people waiting for their appointment, as much as up to 30 minutes beyond when it was scheduled. And miscellaneous items, right? Information, historical information about the provider, the facility. You could do things such as prescriptions and other things like that. We'll get to those, but there's a lot of miscellaneous items in terms of this patient portal. Think of this as kind of the core to this disrupted process, right? Tie it to your EMR, have a single source of information, a single pane of glass that you're looking at where you can evaluate doctors, specialties, locations, wait times, those types of things. The process itself, here's where it starts to get interesting, right? The process itself is not based on picking up the phone and placing a phone call and getting routed through and not sure who to talk to. The process itself is related to the pre-appointment scheduling, rescheduling, and confirmation. And what we're talking about is being able to be self-service and self-sufficient. So instead of placing that phone call, I can jump in my phone, look at my patient app for my provider, where I get my health care from, and I can take a look at a myriad of things, right? I got messages, I got prescriptions, medications, all tied to my EMR, but I can also take a look at the appointments. From the appointments perspective, from my mobile device, I'm able to view my upcoming appointments. What do I have coming up? What's coming up next? Do I need to reschedule that? Or do I need to schedule a new appointment? Maybe I want to take a look at the past appointments, right? See what's out there. See what I've done in the past. See what's coming up. Do I need to do some rescheduling? Again, not picking up the phone, no different than what you've been doing on Expedia and Travelocity for 7 years, right? You'll see this third slide, this third screenshot really is the process around scheduling an appointment. The reason for the visit, maybe I need to include some comments. Hey, I was here a couple days ago, or my post-care directed me to try this. Here's some of the results. Again, what doctor am I going to visit? And then I can browse available times. Again, self-service, putting the control in your customer's hand because that's what they're used to. Seeing available times, calendar picker, picking some time slots for my provider. And then once I've made choices, I can see a confirmation of my appointment in the middle, right? 11 o'clock in the morning, October 18th, here's my appointment. I can call them now if I need to for some reason. I can get directions from this single pane. I can confirm it. Or if you take a look at that third screen on the right, which looks very similar, that's actually a reschedule, the reschedule appointment option. So what have we done? Really jumped into the way things should be handled, right? Not picking up the telephone, it's self-service. Tied to the EMR to see what doctor's availability is, scheduling it, and setting it up. Now, this is fantastic, right? So I've scheduled my appointment. But that's only one piece of the puzzle, right? We talk about this woven blanket, all the features, functionality that can be built into it. When it's time for me to move on to my appointment, I can get a push notification, I can get a text message, right? So onto my device saying, hey, you've got an appointment coming up. Are you going to be able to make it? right? We're back to managing that wait time process. Are you going to be able to make it to your appointment, yes or no? If I say yes, it can give me an option to map directions, right? How do I get to my appointment? Where do I need to drive to? I can see wait times. If I choose I can't make my appointment, I can say, I'm going to reschedule this. I'm going to say, I can't make it. What happens when you reschedule it? The facility gets notified, and what do they want to do? They want to go to a wait list, right? They got to fill that time slot. So we're moving from the patient-centric perspective, me as the person on my phone saying, I can't make my appointment. I'm going to let you know, right? Because it's a lot easier when a push notification comes up to say, I can't make it. I'll reschedule later. And now the provider's aware of this. They can move to a wait list, right? They can go through their wait list and they can say, okay, I know I got this time slot opening up in 2 hours. How do I determine who's going to show up there, right? Do I go by priority? Do I set a priority? Do I do by most likely to pay? Most urgent? Longest on the wait list? Geolocation? Who's closest to me, right? All those things from the provider perspective you can leverage to fill those open slots. So no longer do we have this double booking problem that drives wait times and dissatisfaction. You've now got an integrated experience with your patient for them to tell you, I can make it, I can't make it. How do I get there? Where do I go to? Can I reschedule the appointment? I can see wait times. So what we've done is we've addressed that issue related to the anxiety, the wait times, keeping on schedule, improving the experience, the process for the entire patient. So my phone confirms my appointment. I jump in the car. Technology today, I can drive to the facility, right? It can tell me, where do I need to park? Right? It'll tell me, park in this ramp, walk in this door. But if you've been to some of these campuses, it is crazy from two perspectives. One, I've been to a campus down in, I'll say South Dakota, that has dozens of buildings. I've been down to the one on the U of M campus. More than dozens and dozens of buildings. Sometimes it's hard to find what building you go to. There's going to be new hospitals being built that are going to be larger and more complicated. Where do I go once I get inside? So moving this woven blanket forward from the scheduling of the appointment, the confirmation process, to interior positioning system, right? So service. Show me how to get around. What building do I go to and how do I get there? And there are a lot of different things that can happen in this, from seamless from their GPS maps, having waypoints, directions, turn here, 30 feet, take a left, bank elevators number 1, 6th floor, jump out, take a right, that kind of stuff, right? Get you to the right place. Points of interest, hey, when you're walking by the gift shop, or here's a little historical background on our facility. It gives you a lot of information relative to points of interest and directions. We've got a little video here. We're going to show you how this works. We filmed it because obviously there's a real-time process that happens with interior positioning system. But watch closely for some of these tips that happen within the video. Go ahead and hit it. So cool video, right? Obviously, we filmed that at Network Center. We had to map it out. We had to set it all up. The beauty of that technology doesn't require beacons. Not necessarily requires Wi-Fi hotspots to do it. The technology is embedded within the device, really, is what it comes down to. The magic, I call it, from Joe Dunnigan, the guy walking around there. So fantastic use of technology to improve your customer's experience and make it easy for them to engage with you. Everybody catch on the pieces around seamless from the GPS maps. There's some, I don't know if we did any waypoints, points of interest, but obviously directions. You see the blue dot moving through the floor, throughout the floor, so it's fantastic. Now you've got a process where scheduling appointments, setting up appointments, rescheduling appointments, Google Map direction to the building, and then once you get in the building, things kick off some more, right? Auto check-in. If you know the device that's coming through the door, you know who the person is, why not check them in? Hey, you just walked in the door, geofencing, right? I know you're there. Great, welcome. Pre-appointment paperwork. Why not fill it out online first? Tell you a true story. Had a baby 3-4 weeks ago, and we come home on a Monday, come home on a Wednesday. Saturday, the other kids are sick, take them to the clinic. I got to fill out more paperwork. No, I'm not kidding. I just got done 3 days in the hospital with my wife, and I fill out more paperwork. And why couldn't I just do this online? Why couldn't it be integrated? Why couldn't it be seamless, right? So I'm sure there's rationale and logic behind it, but from a usability or a customer perspective, it didn't make sense, right? So why not some of the paperwork? We also have a great partnership with Zulafly. I know Stephanie's back there somewhere, but RTLS, right? There's a lot of things you can do in terms of managing from a provider perspective, wheelchairs, or how about how the patient moves through your facility, right? So you can understand the flow of patients. You can understand where they're spending more time, where are they waiting, what's inefficient, what's ineffective. I tell you what, McDonald's has been doing it for 50 years. Why doesn't healthcare do it, right? So managing that process with Zulafly and RTLS is just fantastic. Some of the things they can do beyond the simplistic description I've given, it's amazing. So from the pre-appointment perspective, you can see how you can disrupt the marketplace, right? You can turn things upside down. You can do things completely different. Now, the process of engaging with your provider, the doctor itself, very few areas of complaint and feedback. That seems to go well because that's a relationship, right? You're sitting across from him and him or her, and it's going well. But when you leave, that's when the disconnect happens again, right? That's when they're out the building, and that's when things get difficult. From a post-appointment perspective, hey, stop by the pharmacy. You know what? Here's directions to get to the pharmacy. High margin. Swing in there. Pick up your medication. Oh, you got more medication. You go so-and-so that you're a provider for, a caregiver for. They also have a prescription that's going to be too. Why don't you stop by and pick it up as well? Gift store? How about a barcoding for parking, right? Right on your mobile device. Get it validated, really, right? Get parking paid for, scan your phone, why not? And from the post-care perspective, it can be incredible how far you could take that, right? We're talking instructions, tie to your fitness tracker, Fitbit stuff, real-time monitoring. Had a conversation with a healthcare provider from northern Minnesota, talked to him today, talked about some of the educational things you could provide, right? Post-care. It's absolutely powerful, all the things you can do from a post-appointment perspective. And so let's shift that a little bit now and talk not from me, the customer perspective, but from the provider perspective. So from the business perspective, think about the information you can glean and gather because of this integration now you have with your customers, right? This tie you have with their mobile device, the appointments they're setting, the time they're spending in your facility, where they're driving from. Where do I build my next facility, right? Where's everybody driving from? Oh, maybe I should have a location here. Maybe that makes it easier. How about surveys, post-care surveys? Meaningful use, reimbursements. Money's tied to this stuff from the provider's perspective. Reimbursements are tied to satisfaction, meaningful use, those types of things. And you're driving a stickiness, right? So now the big player in the market space has all these little ones nipping at their heels, right? Trying to do it better, trying to do it different. And you can establish that stickiness and that relationship with them beyond just that short relationship they have with the doctor themselves when they're in front of them for 20 minutes. If you can make the process much more integrated, much more tied, you can retain that customer for life. And of course, the last piece is analytics. I'm a big believer in data, right? Again, so understanding what your customers are doing, where they're going, and how they're used through your system, it's just incredibly powerful. All the points you can pull from that. So still sticking on that idea behind the provider, what is their value? Well, from the patient perspective, obviously it's self-service, integrated with EMR, and a single pane of glass, right? Reminders, wait times, wait lists. A shift in expectations, which is good, right? If the expectation is that 80% of the time they're going to be late, even though they expect it, that's not good, right? It's worse that they don't expect it and it's late, but it's just as bad that they expect it and it's late. But you can shift that and you can improve the service and improve the expectations. From the provider perspective, it's even a different way to look at it. What we've learned is that some providers, in this example here, see upwards of a 10% no-show rate. We've seen some that have up to 20%. We've talked to some that have nearly 30%. The mathematics here are staggering. Using the wait list and I can't make it, I can't make my appointment, the math is just incredible, right? 1,000 patients a day is actually a small number. So you see 1,000 patients a day and 10% of them don't make it, and $300 in revenue loss for that appointment. Over time, 30 grand a day, $7.2 million a year. I'll give you a more realistic number. There are providers that we work with that see closer to 10,000 patients a day and a 20% miss rate for 2,000 missed billable segments. That is $156 million in missed revenue a year. And even if those numbers are aggressive, even if those numbers are a little wide, that is a massive amount of money that's being left behind from inefficiency. So forget the customer service piece of it, because there's value in engaging your customers and having that stickiness with them. Think of the revenue that's left on the table because people are frustrated and they're not making their appointments and they're tired of it and the expectations are low. If you can tighten that up, even 1%, 2%, 3%, doesn't take long to get your money back on the project. So here's an example of when you just grab 50 appointments, rescheduled via the app. That's $1 million in 60 days. Just by 50 a day. 50, that's it. And if you're a provider that has 10,000 patients come through a day, 50 is not much. That's a drop in the bucket, but it's $1 million. So it's real dollars we're talking about. So what have we talked about here? We've talked about identifying a market that does things the same way, and it's been doing it the same way. And it's maybe changing, it's maybe evolving, but it's maybe moving slowly relative to the other industries. So once you've identified that, get some metrics based around it and how it performs, and take it from two perspectives. How do you improve it from the customer side? How do you make money on it, right? How do you improve your financials and your bottom line? And what's the ROI look like? So with that, we believe this Healthcare Connect, this connection between healthcare providers and their patients, is a great opportunity to improve healthcare, but also drive more revenue and reimbursements from the provider perspective. So again, does it fit with everybody? Not necessarily, but we think this is a good solution for healthcare. Maybe it fits for manufacturing and banking, but there are other ways. My challenge to you is the what if, right? So think about how you could do things differently, and think about how you can change your market, right? Massive disruption. Questions? Yeah, so the question was, do we have any percentages on, and let me make sure I got this, users in the, well, related to the healthcare system. So here's the dynamic with the healthcare. So the question was, what's the percentage of usage on smartphones for a demographic in the healthcare system, right? Here's how I'd put it. Those people that are coming into the healthcare system have certain expectations around smartphone usage, and those that are exiting the healthcare system aren't necessarily having those same percentages, right? But I know Brad Goder tells a story about his mom or dad that uses an iPad for everything, right? So maybe not the smartphone side, but they certainly use a tablet. And they do it booking appointments, they do it for surfing the Facebooks, right? How do I get online? Some of the things they say is just take it for granted. But so I think what we're finding is specific numbers related to how many people have smartphones based on demographics and area, they're probably out there. I haven't spent a whole lot of time looking for them, but I do know this, the market is shifting, right? So people that are coming in the healthcare market, they're using smartphones. Yeah, and those that are exiting, which is maybe not a nice word to describe it, they're not using them. So, good. Other questions? Thank you for your time, guys. Appreciate it. Enjoy the rest of nVision.